Welcome back. Last session of the Awaken Your Breath workshop. We are going to begin by differentiating again the right and left side of the lung, the right and left lung. And we will do that lying down, relaxing, and then trying to find the expansion from within. We did a little bit of that already in the previous session. Now we're going to do it supine, where we don't have to manage so much gravity, so it might also be a little bit easier to sense it. So you can lie down in a comfortable position on your back with your, I would say, with your feet standing and knees bent for the comfort of the lower back and belly. And we'll take some time to prepare the body for deeper sensing and palpating into itself. So give it some time to soften and relax. Letting the natural flow of the breath gently massage the organs above and underneath the diaphragm. And now bring your focus to the left lung, and you can imagine that pyramid shape from bottom ribs to the top. And feel as if you are breathing only or mainly into the left lung. And we do have this ability to breathe more into one than into the other. Now, can you bring your left arm over your head, but it has to be resting, so somewhere where the shoulder can be on the floor. And then you are intentionally following the filling of your left lung from lower to the upper parts. And in this way you are making sensory kinesthetic contact with the lung from the inside. Feel that the breath is happening from lower to upper. Now, can you feel that as the breath is going from lower to upper lung, it is almost like it's extending into the arm. So it's not going to really move your arm to another position, but it's going to make it just tiny little bit longer. So with an in breath, okay, so we continue. So we're having the left lung expand a little bit into the left arm, making it a tiny little bit longer. On the inhale. And then you can release, bring the left arm down, and bring the right arm up. Gathering all your attention into the right lung. And then feeling that you are sending the breath, or that the breath is gathering in the right lung. Expanding from the inside, gently growing into the shoulder and into the arm. Now, an interesting thing that happens is that the diaphragm is still expanding on the inhale, while at the same time the lung is growing towards the hand. And you can let go of that. And then I would like you to roll to your side and come all the way up to standing. Just gently so you don't get dizzy. But feel how in the standing position now maybe you can distinguish the lowering of the diaphragm and the lifting of the lung. So, the lift of the arm. So the arm is up, and your inhale expands the lung into the chest and into the arm, but at the same time the diaphragm is grounding the leg. And then you can try it also on the other side. So the arm reaches, the leg grounds with the help of the inner body. So the inner body says diaphragm is going down, leg is heavy, grounded, and the chest is expanded by the lung growing into shoulder, arm, even fingers. And then you can try both hands So we have the abdomen, lower, which is the lower body, lower trunk, belonging to pelvis and legs, and the spaces above the diaphragm rising up into the air. Yeah, and then release your hands and maybe take a little walk around your room so that you can see if this is something that you can apply also in your walking and, you know, doing the dishes or tending to your kid, that you can feel this lower body gently pulled down by the pull of the earth, anchoring and rooting pleasantly, whereas with the upper body you are more free and light, ready to reach into the space and people around you. And then you can slowly come back to your mat. It is again going to be the softening of the chest spaces, shoulder spaces, releasing the fascia in the chest cavity, part of which we did in the morning session, and now we're going to do the second part, and I'm going to show you the initial position. So we are going to be on the side, knees bent, and let's say, let me just think for a moment. I'm just trying to think of what is the optimum. I think this is again going to be the optimum position for the lower arm. So you're going to be, if you're starting on your right side, the right arm is extended forward, and you're going to have your hand in front of your head, and the head is resting on the floor, okay? Good. So we're first going to release the weight. And then I would like you to feel this space over here, which is the lower ribs of your upper side, the side that is away from the floor. And then you're just going to lift the head up, feeling that it is not only the neck muscles that are lifting the head, but it's the contraction of this space here. It's the shortening of the side ribs that are helping the head to lift. And we can exhale as we lift and inhale as we release, and then pause for a breath. So we don't want to do it one breath, one movement, but pause, integrate, and then the next breath, when you exhale, you're going to lift. And feel how much of the musculature is being activated in this area. One of the areas that we really want to be able to manipulate with our movement and to contract and release. So when you are lifting, you're contracting. When you bring it down, you release. Because it's another area that, when tight, doesn't allow for the movement of the breath. And the neck muscles are also like a little tent on top that needs to be free and mobile for the optimal breathing. Okay, so now we're going to do something a little bit different. You're going to lift the head, and then you're going to turn to look down towards the floor and then come back. So the breath-wise, you're going to start with an exhale. Exhale as you lift the head, and then continue breathing normally as you turn your head down to face the floor, and then bring it, you first turn it and then you bring it back to your temporal lobe. Again, lifting up, turning, and then release. All right. Now, the position is going to stay more or less the same, but you can relax the upper hand, so the elbow can be soft. And what I want you to do is to move your top knee a little bit more forward and back. So you're moving from the hips, so the top hip is coming forward and back. Yes, great, just a little bit. We don't want to overdo this movement. And you can see it on the knees that one is growing longer than the other. Good. And then bring it back where it was, knee on top of the knee. All right. Now, again with your hand in front of you, you're going to push into the floor, turn the head, and see if this knee sliding is helping you look further back than you did before. That's right, exactly. So we are discovering new pathways that make it easier for us to move. So we are lifting the head, and now the pelvis is going to help. I can see further back than before. And then I rest again. Very good. Now the next one, again you can relax the arm, is going to involve movement of the shoulder. Maybe you can put one hand on top of the other and just slide the top hand to grow longer than the bottom hand. And then back. And this is teaching the rib cage to also come along in the movement. And maybe your legs have picked up and they are also moving the top hip going forward and back. And then we come back. We are ready to try once more to see what difference it makes when we are creating these new patterns. So we're going to push into the ground, turn, and help with shoulder and the hip. They're going to help the movement. And you see how much you have now turned. You are looking all the way to the other wall. So just enjoy it for a few times. Lifting of the head, moving with all these beautiful structures. And when you come back to your side next time, roll to your back, lengthen your legs. Notice how grounded, how given the back and the lower ribs are now to the floor. Okay. When you're ready, roll to the other side. So, of course, we could have just said, lift your head, move your hip, move your shoulder, and look as far as you can. But then there isn't a pathway of learning for the body. So the body can first see here the limitation of using just one part and then slowly build to a more whole body movement. That's one of the points of this practice. Another point is, of course, this wonderful lift that is aided by the lower torso on your right side and feeling how connected that part is to the neck. So for now we are just lifting the head on the exhale and leaving it down on the inhale. And it's great that you have put the blanket underneath your head. It makes it easier. And sometimes having the head down on the side is awkward. So shortening of the right side of the body will bring more length to the left side. Alright, resting the neck muscles, softening as much as you can in this space. And then we add a layer. So the next layer is lifting and then looking down and then returning. And in between you have some moments of breathing normally, resting, and then exhale, lift. Continue to breathe throughout the movement. Alright, stay there, rest the elbow, relax the body, and then when you feel the invitation, you can slowly start to grow your top leg a little bit forward and back. Always looking for least minimal required effort for the movement to happen. And perhaps on this side, because this side has already learned from the other side, you can already bring the shoulder into the game as well. So now there's the shoulder and the hip rolling. The bottom shoulder and the bottom hip are facilitating the movement. And then at some point, as you come back to your side, you're going to lift and involve these other body places into a rotation of the spine and helping yourself to look down and even a little bit back behind you maybe. Sometimes on the days that we are stiff, it is not possible to look behind, and that's okay. We only go to the point of resistance. And we'll do one more lift, roll, and then we're going to rest on our back, having our hands at the lower ribs. Observing the overall breathing process. And now I'll take us through the anatomy of the air passages. So you can take your time to come to the screen for better viewing. Okay. Share screen. So the first thing to notice here is probably how large our nose in fact is. Because even though this is visible, yeah, we say that this is the nose, this part here. In fact, the nose is going all the way back to even to the spine, yeah. So, like we figured, how it is called in Greek. In English, it's conchae. So these are the nasal conchae, and they are the openings or the tunnels in the nose that don't go into the back through a straight line, but they are in a curvy spiral-like shape. And this is so that the air that comes in through the nose has a lot of surface to get enough humidified and enough filtered before going further back into the trachea, bronchi, and the lungs. So here you can see the anatomy of the pharynx. Again, this is the nasal cavity, the conchae. And then there is the so-called pharynx in three parts. The nasopharynx here in yellow, and then oropharynx in blue, and then laryngopharynx in purple. So before we go to trachea, I'm going to stop sharing the image, and I would like us to just come into the feeling of it. So from the image to the sensory information directly from our body. So you can trace from the nose back along your cheekbones and think of the space behind or the inside, what's going on inside of your nose, all the way back to the skull, touching back the ethmoid bone and even the spine itself. And then in one of those strokes that you are doing, you can keep your fingers, with your fingers you can keep your nostrils open and feel this entire inner space of the nose and the little conchae, the tunnels in it. As you inhale and as you exhale. And then release the hands, but stay with your awareness there of the breath coming in and how this breath is getting the moisture, the warmth, and the cleansing as it goes in and back. You can feel that the air that you take in is cooler. The body is going to warm it up before it goes into lungs, and the air that is going out is warmer. You can also feel if one of your nostrils is more open than the other by noticing the shape change of the nostril. So the nostrils are shaped tiny little bit differently depending on how much breath they're taking in. So the air that is going in is not going along a straight line, but it's spiraling through the three conchae, receiving what it needs to receive before going deeper in. And now we're going to look at the trachea. So here is our trachea. It starts just under the thyroid cartilage, under the Adam's apple and vocal cords. And it's going down to approximately the place between manubrium and sternal body. And I will show you on the skeleton where this is in a moment. For now, you can just look at the at all these rings. It has these cartilage rings that maintain its shape, and a lot of mucus inside to again take care of the incoming air, a lot of moisture. This is the inside, this is the cross section of the trachea. So you see all these nerves and arteries, gland, elastic fibers, lymph vessel, muscles. It's so complex, right? And this is the tracheal cartilage around. Okay, so I'm going to stop sharing for you to see also the placement in the body. So this part of the sternum is so-called manubrium bone, and then this is the sternal body, and then this is the xiphoid process. So where the manubrium stops and the sternum body begins, this place is approximately where the trachea ends, and it splits basically. I mean, it's the same tube, yeah, it just divides itself into the two bronchi. It's about 10 centimeters long and about 2.5 centimeters in diameter for most people, in diameter. So it also has movement, pulsation, so slightly widens and elongates on the inhale and slightly condenses on the exhale. All right, so let's see if we can bring our awareness to this spot at the bottom of the trachea and feel how the breath, so now we are continuing the journey of the air from where it was in the nose and in all these spaces underneath that I said, and then the trachea. And then we're following it to that place of division. So where your breath from one tube starts to become two. And then also bring the palm of your hand. This is usually very calming for most people, perhaps also because of the thymus gland or some meridian reflexology points. Just to bring the hand there and to continue to breathe in this way of splitting the breath from 1 to 2 and then back from 2 to 1. And then we'll go slowly into the bronchi and their division into bronchioles and further subdivisions of the at the end of which is the alveoli. So here it is. Already you can see here the two bronchi. And I'm going to go further down where it's a little bit more emphasized. Yeah, so these are the primary bronchi. And then here are the secondary. And then tertiary, they're so called. So it's just dividing and multiplying into smaller and smaller tubes until we find the bronchioles as the smallest ones. So it's so beautiful. It's really like a tree, yeah? So if you bring your hands to your lungs and imagine all this branching out, and feel this beautiful, wonderful network of tubes as they become smaller and smaller. Because they have to become small if they're going to be able to exchange gases, if the body is going to be able to exchange gas, oxygen and carbon dioxide. And then we're going to go smaller and smaller, like we said, until we get to alveoli. So the small sacs at the end of bronchioles. This is how they look. You see how there is a blood flow, there are arteries and veins that are going to be responsible for circulating of the gases. And it is these little sacs inflating, deflating that we feel as the expansion and condensation of the lung. These are the lobes that we did already. Okay, so I'm going to stop sharing. So alveoli, their job is to move oxygen and carbon dioxide molecules into and out of the bloodstream. They are, I just want to see the information. Right, so the walls of the alveoli are very thin, enabling the exchange of gases so that the gases can pass easily between alveoli and capillaries. Capillaries are the blood vessels. There it is. 1 cubic millimeter of lung tissue contains around 170 alveoli. So this small millimeter, 170 of these sacs. So you can imagine how tiny the sacs are. And the human lungs have a surface of roughly 70 square meters. So we must be having millions of alveoli in our lungs. All right, so we're going to continue to trace and maybe go from high up, massaging the nose a little bit, and then going to the mouth and massaging the jaws, and then feeling the pharynx and trachea, and then slowly into the lungs where we have our beautiful alveoli, these beautiful sacs, taking in and expelling out. All right, and now you can release your hands and go back to the mat. And find a comfortable resting pose. Well, let's do a restorative forward fold. Do you have I don't know if you have bolsters and blocks. If you do, then you can set up like this. I'm going to show you for a restorative child's pose. And if you don't have this at home, then lying on your side and hugging something to have comfort and support for the front body is recommended. Yeah, perfect. So our bronchi and alveoli, they are not just in the front, they're also in the sides and in the back. And we can now, with the mind's eye, trace this pathway of air. Starting with the outside space of our nose And how the air beautifully enters our nostrils, gets warmed and moist, and then travels down the pharynx, the trachea, splits into bronchi, bronchioles, and goes all the way to the tiny micro alveoli. Alveoli are the end point of our respiration. This is, the air doesn't go further than that. But the contents of air, the oxygen is traveling. It's getting picked up by the bloodstream, and it's traveling all around the inner body. Now, can you find the place in your lungs where you don't have a lot of sensation? So maybe you have a more condensed side of the chest, or maybe you have a particular place where the ribs are not moving so much, or where you feel it's hard for you to access. You just don't have any sensory dialogue there. So in such places, I invite you to visualize your air sacs and to really not rush, but to first just visualize them and then wait for the right moment to start to feel the pulse, or to imagine the pulse of the sacs. And then see if anything changes, staying with that area of your body for a while in this way, for some minutes. And you can stay like this, or you can change the position of the head to the other side for one more minute. And then when you are ready, slowly lift yourself up to seated. Notice how you are breath-wise and pose, position, alignment, how does it feel? Does anything in your chest and belly area feel more free than before? going to go into the pranayama called Mobius breath by Joan Avison. And it is something that you can do and you can teach, and you don't have to do a lot of rounds. But what she suggests is, I think 5 or 6 rounds of this kind of breathing, but 2-3 times a day. So of course you would begin with 1 time daily, and then you would go 2 times and 3 times. It really gets you in touch with breathing as a combination of voluntary and non-voluntary mechanisms, the autonomic and the somatic nervous system involvement. And it also helps you find a midpoint, or madhya. Well, this is at least my experience. She doesn't talk about it in terms of madhya, but if you remember from tantric philosophy, madhya is that space in between, yeah? The space between the breaths, or the space that can start to occur between the thoughts, yeah? Or the space between your previous action and the next action. So it's like opening a little gate. And the Hoberman sphere will help us, because as we know, there is the in-breath, so there is the expansion, and there is the out-breath, they're gathering. However, we do not ever gather completely, because that would be collapsed lungs. And we don't expand indefinitely, so there is the limit to the expansion. So this is about our resting place of the breath, not completely exhaled. So what we'll do is we're going to inhale naturally, then we're going to add a little bit of effort to the inhale. Then we're going to see that the exhale comes naturally, so it rebounds. And there where it would normally stop, we're going to add a little bit of effort. And that's 1 round. Okay? So preparing, we just relax the body and mind. And then we inhale and exhale, and then we begin. So inhaling, and then adding a little bit of effort, then exhaling effortlessly, and then continuing with a little bit of effort in the exhale. And then you will see how the inhale rebounds naturally. Then you add a little bit to it. The exhale rebounds, and you add a little bit to it. And you can continue like that for 3 or 4 more rounds. And when you finish, return to spontaneous breathing, but begin to pay attention to the pause after the exhale. And in this natural pause, or if you cannot detect it naturally, you can make it a 1 second, a 2 second pause. Marinate in this nothingness, in this vacuum of no in-breath, no out-breath, nothing to do, nothing to think of, just space and emptiness. the madhya, the space in between. If you can observe your mind, possibly you can see some gaps between the streams of thought or the trains of thought. Just for a moment there could be a no thought moment. And then gently, when you are ready, you will find your way again to your mat to lie down in a comfortable position. Perhaps now, with all this refined sensitivity, the questions that I'm going to be asking, and this is inspired by Mark Stevens, the questions about the breath are going to be more clear. The answers are going to be more clear. And it's not so much about the answers as it is about response to the question. It's called basic breath awareness, and it is something that I recommend both as practice and as teaching to be the foundation, the first layer before building any simple or complex techniques of pranayama. So there are 4 stages of the breath, which is the inhale, the pause after the inhale, the exhale, and the pause after the exhale. So first, the body relaxes on the floor, and then the awareness goes to, what does the inhale feel like in my body? And this is without changing or trying to take a deep breath. And you will see that just the act of attention might already change the breath, but it's okay as long as you don't try to make deeper breaths or anything like that. So what does the in-breath feel like? What anatomical structures can you feel responding to the breath? Is your chest responding to being breathed? Is your belly responding? Pelvis? Throat? Head? What parts of your spine respond and move with the breath? Especially with the in-breath, can you detect any movement in the lumbar or even in sacrum? And all you have to ask yourself is, does my sacrum feel the same when I'm breathing in than when I'm not? And there you can spot a difference. Then observe how your body feels at the very beginning of the inhale. the first thing you notice in the body as the breath flows in, and then how it changes while it's flowing inside you towards half and towards full. And then the next question would be, what do you feel at the top of every inhale? What is the length of the natural pause between inhale and exhale? What senses are there in the body during that pause? And what changes can you notice in the mind in that pause after the inhale? And now we go to the exhale. Where in your body do you feel the first movement of the exhalation? What parts of your spine respond to the exhale? Can you feel anything in the lumbar or sacrum even? And what is the overall quality of exhalation? Does the breath tend to quickly run out, or does it take its time, or is it smooth, or how is it for you? There's absolutely no right and wrongs here. It's just observing. What changes do you notice in the body and in the awareness as the breath goes away? And what changes do you notice in the mind? And you can compare the inhale to the exhale. Is there any difference in the mindset or mind state between the two? Is there more alertness or more relaxation in one or the other? And finally, how do you feel when you are empty of breath? How long does the breath stay out? Is it easy or hard to stay conscious of the pause before the next inhale? And what is the mind of the pause? How is the mind in the pause after the exhale? And you can return to the wholeness of the breathing. And then you can shift your position to side lying for our last meditation on this cellular breathing. So somehow you make yourself as comfortable as you can on your side. You can cover yourself, you can have cushions around you, underneath you, blankets under the head. So what we call the body is these trillions of cells that are suspended in fluid, which is in constant motion. So on the inside we are always moving, even when on the outside we are in relative stillness. And the movement itself is the nourishment of our cellular life. So you can begin to connect to that, which is this sweetness, this deliciousness of nutrients flowing through the bloodstream and nourishing every corner of your being. And then the elimination or the carbon dioxide and other products of the metabolism are being released into the fluid, and from the fluid into the blood and lymph to be taken out. And then you can also feel how your exhalation is going to be the nourishment or the food for the plants and trees of the planet. Surrendering to the ease and the spontaneity of this relationship, this ongoing relationship that starts ever since your conception, and it is going to be there until your last breath. The direct interdependence, giving and receiving with planetary life. And as your body relaxes further and further, maybe you can feel that the cells are breathing directly through their membranes. And how this cellular consciousness makes you feel about yourself. How does it change our perception of who we are and what we're here for? And now, if you remember from the beginning of our time together, the movement of the jellyfish and how you can experience this primal pulsation in every cell of your body, in every organ, in every diaphragm, and in the body as a whole. So however micro you choose to go, or however grand, it is the same template of life, expanding, condensing in this beautiful rhythm, delivering, taking away, waves of prana flowing throughout the body. And it is the same pulse with which our planet and other celestial bodies are pulsating, the same thread, the same mandala in our entire universe. So you can allow this sensation of pulse to again coax you a little bit into some movements. And then as you take your time to come back sitting, bringing our part of our awareness back into our virtual space, virtual connection. Completing always like we started, with hands on our heart, with connection to our heart space, heart center. And expressing gratitude to our body and to our senses and everything that makes up for this embodied life experience, and to each other for energy and support and held space. One Om together. Inhale. Namaste.